here's the tricky part. The insurance company, the managed care company, kind of has to guess how much care their members are going to need. So they know that some people will need less care. So if you remember when you're like 20 and you're bulletproof and you never go to the doctor, but some people will need more. The elderly usually need a little more care. They have more expensive care. Folks with chronic conditions, and that would include bleeding disorders, also might need a little bit more care than the average person. So you've got this mix. And if you look at the circle, you'll see 3 people with IV poles. And I'm not discriminating by saying that people with bleeding disorders run around with IV poles. Those are just to symbolize that those are folks who may need more care paid out on their behalf. And that's known as risk. So the insurance company then has to look at how much do I have coming in versus how much do I think I'll have going out, which is the risk. They just need to make sure that those are pretty close to equal, or that they've got more money coming in than going out. So next one. This is for those of us who like math. This kind of shows, on the last slide, we had 10 little people in that blue circle, and they were 10 members. So if you look at this little chart, you can see that, gosh, member number 2 paid in a premium. And then in the second column, you say, oh gosh, but they didn't have any care. So a claim did not need to be paid out by the managed care company. And then maybe the following month in April, they only needed $5 worth of care. And again, they would have paid in for April $10 in premiums. So you can also look down and go, oh, well, look at member number 3. They're always getting more care than their $10 monthly premium. So the insurance company has to kind of figure out, again, if we have a set number of members and they're paying a set premium and deductible, et cetera. So that's what money's coming into that managed care company. We just need to kind of make sure we're not pushing more money out, paying the claims on these folks. Because if we had to do that, we'd run out of money and we'd go out of business. Does that make sense? All right. So then how do they stay in business? As we said, they can either increase their income, which means raising the premiums or raising the deductibles or raising the copays, or they can decrease the cost, which means they can negotiate with more providers to be in network and pay them that reduced rate. Or they can also decrease costs by taking out a benefit. So for example, let's say the insurance company says, we're not going to cover physical therapy anymore. That's a way to decrease their costs. You as a patient still might need physical therapy, but it would not be covered by your health insurance. So that's kind of the magic equation. And if you think about that, you would say, well, that kind of shows me that an insurance company has no incentive to give me care. It would be better if they just took my premiums and didn't pay anything. So there is the safety valve in this is managed care companies are looked at quite a bit by regulators, so by states, by by state insurance departments, et cetera, to make sure they're providing good quality care. So that way, the insurance company isn't just denying care to save money. So they need to make sure that you stay healthy as you're a member of their insurance company.
And I would just add too, another way they could increase their income is by having more members, right? If they have more people paying in premiums, that will help spread the risk across a larger group of, that helps with the risk because it's spread over more members usually. And there is an element of the market which works in this regard too, because if they don't really cover anything, then why is anyone going to choose to choose to pay premiums into that plan, right? So if nobody wants to become a member, then they can't get enough members. So they're trying to come up with that balancing act that you're talking about, of offering enough care that they can get enough members paying premiums, but not offering so much care that that they're spending more money than they are making on their premiums.
Yep, exactly. And as they look at getting more members, they can't cherry pick. They can't just say, oh, we're only going to now enroll members who are young and healthy and don't use healthcare. They can't do that, but they also can't say, we're not going to put anyone in who has a chronic disease, a bleeding disorder, who's elderly, et cetera, who might cost us more. So that's risk, as they sometimes don't know they can't cherry pick who they're getting. So they just have to keep an eye on that equation all the time. All right, so that's lovely. That's our little business lesson for today.